Hi, welcome to my channel. My name is Nicolette. I'm a tutor for nursing, and this is from the Gab-Nic Excelsior Nursing Tutoring Center. I know there are multiple videos out there about NCLEX, about nursing, about how to pass, but this is a video that's a bit different. This is actually a reading of a Saunders NCLEX book. One of the things that I tell students is that they really must go through at least one NCLEX review book. So this is just me reading and explaining the NCLEX book as I read it to you. This way you can have a study buddy as you go over your NCLEX review book. Okay, so here we go. Today we're covering fluid and electrolytes. And as I read, I will pause to make notes, to make statements about what I'm reading, what I understand, what you should be thinking about. Okay, so cell properties, concepts of fluid and electrolyte balance. So electrolytes. Description: when a substance is dissolved in solution and some of its molecules split or dissociate into electrically charged atoms or ions. 2. Measurement. To measure volume of fluid, the metric system is used, liters or milliliters. The unit of measure that expresses the combined activity of an electrolyte is the milliequivalent. So you will see when you have a dosage of some medication that it's milligrams, milliliters, MEQs. So this is where you're going to see that measurement in nursing. Fluid, body fluid components. Fluid in each of the body compartments containing electrolytes. So when it talks about body compartments, I'm thinking about what is it? The interstitial, the veins, the valves. I'm thinking about organs. I'm thinking about cells, like all of those different compartments inside the cell, outside the cells, right? Those are the compartments that it's referring to. Each compartment has a particular composition of electrolytes that differs from that of other compartments. So when you think about the electrolytes and you think about the fact that it says 7.45 to 7.5, or I should use an electrolyte, that's actually a pH. When you think about, let's say sodium, which is 135 to 145, or potassium, which is potassium is, what is potassium? I forget. 3.5 to 5.0, you think of that measurement is inside of the cell compared to outside of the cell. So different compartments have different values, right? Also, when you think about, which we'll see later, permeability, we see when fluids and electrolytes are able to come in and outside of cells, they're coming in and outside of a compartment. And so the value of the fluid inside, outside of the cell matters, right? Inside and outside of a compartment is very important. It's important for burns. It's important for when I give a patient fluids. It's important for medications that I give and the chemistry that works, or how it works inside the body when it is deposited in an IV, in a pill. All of that is important. To function normally, body cells must have fluid and electrolytes in the right compartment and in the right amount. Again, when we talk about burns, for example, when a person gets a burn, that permeability is broken, and now the fluid that should be inside the cell is outside of the cell, and that's why you have the swelling. You have edema because the amount of fluid in a compartment is different than it should be. You have interstitial fluid going different places, so it's a bad thing, right? Whenever an electrolyte moves out of a cell, another electrolyte moves in to take its place. So this here, I'm thinking about, it's talking about equilibrium, right? The body always wants to be in a state of equilibrium. It wants to balance things out. So when one thing goes out, another thing must come in so that it can make it equal, so the body can feel that it's not in grave danger. Number 5, compartments are separated by semi-permeable membranes. So that's just the outside, the lining, the enclosure of a cell. So that thin lining that encircles a cell is a membrane, and it's either permeable, semi-permeable. It allows some things, which means it allows some things in, and it doesn't allow some other things. Okay, then we have the next topic, which is third spacing. The accumulation and sequestration of trapped extracellular fluid in an actual or potential body space as a result of disease or injury. So here the focus is on a space, right? This here is, so the fluid that can be used for something else is not being used because it is trapped in a space where it cannot come out. The trapped fluid represents a volume loss and is unavailable for normal physiological processes. Number 3, fluid may be trapped in body spaces such as pericardial, that's around the heart, pleural, that's around the lungs, peritoneal, that's around the stomach, or joint cavities, the bowel or the abdomen, or within soft tissues after trauma or burns. Okay, so number 4, assessing the intravascular fluid loss is difficult. It may not be reflected in weight changes or intake and output records. It may not become apparent until after organ malfunction occurs. So this is a very bad thing, because usually what it's trying to say is, if a person is going to lose weight, you want to monitor that. You want to make sure that they have enough fluid in every compartment, because if they're losing weight in general, that means they're losing fluids where they should be, whether it's interstitial, whether it's your blood vessels, whether it's your kidney, whether it's your lungs or in your heart, wherever there's fluids in specific places, even in your brain, right? Your brain has ventricles that produce fluids, right? So there's fluids everywhere. When you lose fluids, it's bad because those places do not have the amount that they should have. So now, usually if you're trying to figure out how, or if a person is losing fluids, you weigh them. But when the fluid is being lost in the blood vessels, it's not very apparent, and you cannot really tell, because usually what is said earlier is that if one thing goes in, another comes out, so it kind of balances it out. So you're not really losing it from the body. It's not coming outside, it's staying inside, but it's going to another place. So let's say the blood in your heart, the fluid in your heart is leaving and going to your lungs. So it's still inside the body. So when you weigh the person, they weigh the same, right? But you won't know they're losing fluid in one compartment unless or until that actual organ or compartment starts to show it with organ damage, right? That's how you're going to find out, because the person is not actually, the fluid is not actually leaving the body. Okay. Next, we have edema. So an excess accumulation of fluid in the interstitial spaces, right? So we make the distinction between fluid inside the blood vessels, fluid inside the cells, and fluids outside the cells. So fluid outside the cells are in the interstitial spaces. So when that fluid increases, that causes edema. Localized edema occurs as a result of traumatic injury from incidents or surgery, local inflammation processes, or burns. Generalized edema, also called anasarca, is an excessive accumulation of fluid in the interstitial space throughout the body as a result of a condition such as cardiac, renal, or liver failure. So here, I want to make the distinction to explain that. So when a person has localized edema, that is curable. That is manageable, because you can change position and the fluid goes back to wherever it came from, or it gets dissipated into where it needs to go and it goes away. For example, if my hands are swollen, I lift it up, then the fluid goes right back to my heart or goes back to where it needs to go, and the swelling goes down. Same thing with my legs. They always tell patients if they have swelling in their legs, a pregnant woman whose legs are swollen, they tell her to lift her legs up, right? So that fluid goes back to the heart. It's fine. that is localized. It is in one place. But when you have anasarca, it's everywhere. There is no position for you to put yourself for it to go away. That means by the time it gets to that point, organ damage is so vast, so much, there's no helping that person. Usually that person will die unless a huge miracle happens. Okay, so that is generalized edema. Conditions such as cardiac, renal, or liver failure happen. So if you have your heart failing, your liver failing, all of that, there's like hardly anything you can do for that individual. Next is body fluids. So body fluids description provides the transportation of nutrients to the cells and carries waste products from the cells. So you see that how important fluids are, because you want to get rid of wastes and you want nutrients to move all around the body, right? So if you don't have fluids, you won't have those things happening. So you can't, the body become toxic and the nutrients do not travel where they need to go, and you're not going to be as healthy as you need to. Total body fluid amounts to about 60% of body weight. The loss of 10% of body fluid in the adult is serious. So 10% seems like a little bit, but to us it's a lot. And it's the same thing when you think about your electrolytes, right? The values, when you memorize them, you'll see a few numbers away, a few digits away from the norm can cause a very serious effect to the body. So always pay attention to the numbers of whatever the limits should be for whatever electrolytes, whatever labs you're thinking of. A loss of 20% of body fluid in the adult is fatal. A loss of 20%, constituents of body fluids. Body fluids consist of water and dissolved substances. The largest single fluid constituent of the body is water. So we saw that it's 60%. That's more than 50. Another thing I can say to this effect is, I've been told when you use the bathroom, right, and you pee, there's usually something that happens, right? For example, if you were holding your pee for a very long time and then you relieve yourself, there's this whole shivering effect where it's like, it's a wonderful feeling or a strange feeling or whatever you can call it, but it is a feeling that happens because of the change in the release and the fact that your body is getting really rid of so much fluids. That same idea should call to the importance, or should remind you of the importance of losing fluids in your body. It affects your body greatly when you lose fluids. So that is one of the reasons why dehydration can be so serious. Dehydration can kill a child and can kill an adult, because those two groups of people have, you know, they feel the effects of water even more so than you and who is, you know, middle-aged, and like it just didn't affect us as much. So just be aware that dehydration is a very serious thing and it can kill you, right? We've heard that in the news. We've heard that, you know, reports where, you know, if there's a heat wave, right, they tell you to be careful to drink lots of water because it's very serious. Moving on. Body fluid transport. So we have diffusion, the amount of particles in all directions, the movement of particles in all directions through a solution. So with diffusion, diffusion occurs within fluid compartments and from one compartment to another if the barrier between the compartments is permeable to the diffused substance. So diffusion is talking to substances, like the particles, like not the water, right? So it's the particles in the water, how they move. So they can move from one place to the other. So we talked about the semi-permeable, right? So when the particles are leaving the membrane, that is, or moving around the membrane, I should say, when it's moving around the membrane more so, that is diffusion. Diffusion of a solute is the particle, the substance, spreads the molecules from one area of high concentration to an area of low concentration. So an area of high concentration just means that there's a lot of it here and there's a little bit of it out here. So again, you can move substances throughout a membrane, or you can move it outside of the membrane. So if there's a lot of it here, you want to move it outside, it can work that way. Or if there's you put like a drop of dye right here, it's particles, and then it's going to spread throughout. That's diffusion. A permeable membrane allows substance to pass through it without restrictions. So again, the membrane, if it's leaving the containment, the confinement, right, it can leave if that surrounding barrier allows it to. But if it doesn't, it will stay inside. So semi-permeable means it lets some things in. And some things do not go in or out. A selective permeable membrane allows some solids to pass through without restrictions, but prevents other solids from passing freely, right? So that's the semi. The permeable, everything goes in, anything comes out. Now the next type of transportation is osmosis. So osmosis pressure is the force that draws the water from a less concentrated solution through a selective permeable membrane into a more concentrated solution. So osmosis pressure is a force, right? It's a force and it pushes water. So osmosis has to do with water as opposed to diffusion, which has to do with particles. So when they talk about osmosis, only think of water, movement of water. If a membrane is permeable to water but not to all of the solids present in it is selective or semi-permeable membrane. When the solvent, solution in which the solvent is dissolved, or water moves across the membrane, the process is called osmosis. So you have a solute, which is the particle, the hard substance, and you have the solvent, which is what the substance dissolves in. So the solvent could be any solution or it can be water. So when you have a solution that has both the solvent and the solute in it mixed around, that makes a solution, if there's osmosis, it will allow the solvent, the water, the fluid, to move into another space, but it will keep the solvent, the harder particles, from moving with the fluids. Filtration. Filtration is the movement of solutes and solvents by hydrostatic pressure. Hydrostatic pressure is the force exerted by the weight of a solution. The movement, so filtration is the movement of solutes and solvents. So diffusion was just the particles, just the solvent. Osmosis is just a solute, and now filtration is both together. Okay, hydrostatic pressure is the force exerted by the weight of the solution. So the pressure is hydrostatic pressure is everything together moving in one unit, and if it's heavy, if there's a lot of it, then there's a lot of pressure. If there's a little bit of it, there's a little bit pressure. So that's hydrostatic pressure. The movement is from an area of greater pressure to an area of lesser pressure, right? That's the same idea with osmosis, but remember osmosis is only with water, whereas well, actually, that's the idea with all of them. That's the way they work. We will see later that there is active and there is passive, but for now, we're trying to move. The natural flow of things is to move from a place where there's more pressure to a place where there's less pressure. Next is osmolality. So osmolality refers to a number of osmolytically active molecules per kilogram of water. In the body, osmotic pressure is measured in millimoles. Here we're going to see when you talk about urine, they also talk about osmolality, and the idea is how much solutes, how much electrolytes, how much weight does the urine have? Is it watery? Is it there's a lot of water, or is it very, very, very yellow, very, very dense, meaning they're keeping a lot of water in and losing a lot of salts, right? This is where you'll see this idea of osmolality mentioned mostly. The normal osmolality of plasma is 280 to 294. In the body, the osmotic pressure is measured in milliosmoles. We said that. Now the hydrostatic pressure. The force exerted by the weight of a solution when there is a difference in the hydrostatic pressure on two sides of a membrane, water and diffusible solutes move out of the solution. that has the higher hydrostatic pressure by the process of filtration. Okay, so here, if you think of this, this is talking about how blood moves throughout the blood vessels, right? So you'll have pressure of the blood as a whole with all its solids, all its fluids going down the gradient, but then you might have some diffusion, you might have some osmotic activity, and because of the pressure, some fluids might come out or go in to the capillaries and the arterioles and all of that, right? So this is the idea that's being presented here. And when you think of hydrostatic pressure, you should definitely think about blood pressure, because when the blood is being pushed against the blood vessels, it causes pressure, and that is how blood pressure is measured. So when you have a lot of fluids, you'll have a high blood pressure. And if you have less fluids, you have a low blood pressure because there's less pressure on the blood vessels, or there's more pressure on the blood vessels. At the arterial end of the capillaries, the hydrostatic pressure is greater than the osmotic pressure. Therefore, fluids and diffusible solutes move out of the capillaries. So if you were ever wondering how the arterial blood, takes back, how the transfusion, or how because you have arterial blood and you have blood in the vein. How does it transfer? How does the body take the bad blood from where it is to where it needs to go, and how does it take the good blood where it is to where it needs to go? So the capillaries is where that happens. So if anything, the blood is able to pick up debris or whatever from the capillaries, and it pulls it into the capillaries, right? And then into the vein, and it travels in the vein. So this is where all the action is done or happens, in the capillaries, because the pressure gradient is different there. Okay, there's more pressure. So it says, at the arterial ends of the capillaries, the hydrostatic pressure is greater than the osmotic pressure. So the pushing pressure, that's what we call hydrostatic pressure, is greater than pulling pressure. Therefore, fluids and diffusible solids move out of the capillaries. At the venous end, the osmotic pressure or pulling pressure is greater than the hydrostatic pressure. So in the veins, they're able to pull things into them, and in the arteries, they're able to push things out of them, which makes sense, because you want to be able to pull bad blood into the veins so they can travel and then leave the body, and you want to be able to push nutrients out of the arterioles into the rest of the body, so that the other organs and whatever else, wherever that artery is, they can get nutrients as well from the artery. The excess fluid and solids that remain in the interstitial spaces are returned in the intravascular compartment by the lymph channels. So when this activity is happening of pushing fluids out of the arterioles and pulling fluids into the veins, at some point some water will remain, or some fluids will remain, and that fluid won't go into the arterioles, neither will it go into the veins. It'll be picked up by the lymph nodes. That's what it's saying, the lymph channels. Okay, so we're going to stop here. I don't want to give you too much today, and we will resume at another time with fluids and electrolytes. Thank you for watching. I hope this was helpful. And if you like this and want to continue, give it a thumbs up. I'll see you next time. Bye.